What is myositis? Myositis is related to autoimmune disease. It is an immune system issue of rare conditions. Myositis is a disease that makes your immune system attack your muscles. It causes chronic inflammation. It is a muscle swelling that comes and goes over an extended period of time. This inflammation makes your muscles feel increasingly weak. It may also lead to muscle pain. Myositis is a type of myopathy. Myopathy is a general term that refers to diseases that affect the muscles that connect to your bones, which are also called skeletal muscles. Different forms of myositis affect different groups of muscles throughout your body. Myositis usually affects the muscles you use to move, including muscles in your arms and shoulders, legs and hips, abdomen and spine. Other people with myositis experience muscle weakness on or near their eyes, esophagus, diaphragm. There are different types of myositis, including polymyositis, which affects many different muscles, particularly the shoulders, hips and thigh muscles. It's more common in women and tends to affect people aged 30 to 60. Dermatomyositis, which affects several muscles and causes a rash. It's more common in women and can also affect children. Inclusion body myositis, IBM, which causes weakness in the thigh muscles, forearm muscles and the muscles below the knee. It may also cause problems with swallowing and is known as dysphagia. IBM is more common in men and tends to affect people over 50. Symptoms of myositis. The main symptoms are weak, painful or aching muscles. This usually gets worse, slowly over time. You may also trip or fall a lot, and be very tired after walking or standing. Polymyositis affects many different muscles, particularly around the neck, shoulders, back, hips and thighs. Symptoms of polymyositis include muscle weakness, finding it hard to sit up or stand after a fall, swallowing problems, or finding it hard to hold your head up, feeling unhappy or depressed. You may find it difficult to get up from a chair, climb stairs, lift objects, and comb your hair. The muscle weakness can become so severe that even picking up a cup of tea can be difficult. Muscle weakness may change from week to week or month to month, although it tends to steadily get worse if you do not get treatment. Myositis is an autoimmune disease. Autoimmune diseases are the result of your immune system accidentally attacking your body instead of protecting it. Myositis patients are usually required to undergo tests such as blood tests to check for raised levels of enzymes and antibodies in your blood. Skin biopsy, in which a small sample of muscle tissue is extracted so it can be examined for swelling, damage and other changes. MRI scans. Electromyography or EMG, where a small needle-shaped electrode is put through your skin and into your muscle to record the electrical signals from the nerve endings in your muscles. Exercise is a very important part of treatment for all types of autoimmune patients, including myositis. It can help reduce swelling, give you more energy, and build up or restore your muscle strength. Exercise and physiotherapy are important if you have inclusion body myositis, also known as IBM, as these are the only treatments for this type of myositis. IBM cannot be treated with medicines. You should speak to a general practitioner and physiotherapist before starting a new exercise program for myositis. They will help to make an exercise plan that is right for you. It is very important to maintain gentle movement of your muscles and joints, especially if myositis developed during childhood. Most people with myositis respond to a combination of steroid and immunosuppressive therapy, alongside carefully controlled exercise. Steroids are the main type of medicine used to treat polymyositis and dermatomyositis. They help to quickly reduce swelling and ease muscle pain. They can be given as a tablet or injection, or directly into a vein through a drip. You will usually be given a high dose to start with, which is reduced over time. High doses of steroids taken over a long time can cause side effects. These include weight gain, high blood pressure, diabetes, cataracts which can cause cloudy patches in the lens of the eye, osteoporosis which causes weakened bones. You should speak to a general practitioner before you start on any medicine. If the swelling in your muscles flares up, your doctor may prescribe a disease-modifying anti-rheumatic drug also known as TMARD. MARDs, such as azathioprine, methotrexate, cyclophosphamide or mycophenolate, suppress your immune system and help reduce swelling. These medicines take time to work, but in the long term, they may help you to reduce your dose of steroids. This can help ease the side effects of steroids. Very rarely, you may need immunoglobulin therapy to stop your immune system attacking your muscles. This involves having an injection of healthy antibodies also known as immunoglobulins from donated blood. Immunoglobulin therapy is given in hospital, usually directly into a vein through a drip. Biologic therapies, such as rituximab, can also help manage the symptoms of myositis. They are widely used to treat conditions such as rheumatoid arthritis and psoriatic arthritis. They help to reduce swelling and tend to only be used for severe myositis. I hope you might have found this information interesting and knowledgeable. Please do not forget to like and subscribe to my channel.